Hello, good afternoon, everyone. My name is Jana Bitten. I'm the Executive Director for the Oregon Center for Nursing, and thank you so much for joining us today on our webinar, where we're talking about our most recent report, Shortage or Maldistribution, Shifting the Conversation about Oregon's Nursing Workforce. For those of you who are not familiar with the Oregon Center for Nursing, we are the state's nursing workforce center in that we have a mission that's twofold. The first part of our mission is to pull together research about the nursing workforce so that people can make informed decisions about workforce planning and other policy. We also try to convene different groups together, different stakeholders together, so that we can put that research into action. So when we do our research, we have fundamentally, we try to look at three different areas of the nursing workforce. The first area that we look at is about the supply of the nurses in the state. Then second, we look at the demand for nurses in the state. Third, we look at the educational pipeline for how we are creating nurses. Last January, we put together a presentation about our demand for nursing professionals, and this presentation is going to address the supply of nurses in the state. But this has a little bit of a different spin because the supply of nurses is a little bit different now than it has been. It's been changing quite significantly over the past 15 to 20 years, and just looking at supply is a little bit different. So this presentation is put together to explain that. And with that, I'm going to turn it over to Oregon Center for Nursing's Research Director, Dr. Rick Allgeier.
Good afternoon. My name is Rick Allgeier, and I am the Research Director here at OCN. And we are going to talk to you about our latest study today, looking at the shortage of maldistribution, where we're actually looking at shifting the conversation about nursing workforce. This is a somewhat different take than we did last year. If you remember when we did the 2016 data, we really put together a data book showing the nature of nursing. But one of the things that kind of struck us when we were looking at the data this time was some of the rapid growth we're seeing. And so that kind of led us into a somewhat different direction, in that one question we always get is, are we in a shortage, or is a shortage coming? A lot of people are very concerned about nursing shortages, and for good reason. Shortage of nursing has a lot of downstream effects in healthcare, because nurses are by far the most numerous healthcare workers there are in the state and in the country. So we look at this really carefully. And so what I'm going to do is I'm going to start talking about just the state of nursing a little bit, and talk about how that fits into our view of a shortage. So on this slide, what you'll see is the number of licensed nursing professionals that are in Oregon based on 2018 data. So from this, you can see that there's 18,000 nursing assistants, 5,200 LPNs or licensed practical nurses, a little more than 55,000 registered nurses, and 4,800 advanced practice nurses, which includes nurse practitioners, nurse anesthetists, CNSs. So that combines all the advanced practice nurses and nurse practitioners in that. Below it, so we also provide an estimate for how many are actually practicing within the state of Oregon. And you can see that that number is somewhat different. It usually, on average, it's about 80% of the licensed practitioners are actually practicing in the state. And this is an estimate. And the reason we come up with this estimate is because there's a cohort of nurses, especially ones who are newly licensed, that we don't know a whole lot about. The survey in which this data comes to us, the survey is taken by the nurses upon their first time they renew their license. So new licensing, we don't really have a lot of information, so we have to estimate what it is. And so what we do is we look at all the nurses that we know information, the nurses who have completed that workforce survey. And from that, we determine what proportion of those nurses are actually working in Oregon, because we have work addresses and we have a lot of information that lets us know that they are actually working in Oregon. Then we take that proportion of nurses that we know about that are working, and we apply that same proportion to the number of nurses that we don't know anything about because they're newly licensed, or for whatever reason they didn't complete the workforce survey. And so that gives us a pretty close estimate to how nurses are actually practicing. And so what you can see from that is it's about 20% fewer are practicing than were licensed. So we have 15,500 CNAs, 4,300 LPNs, 42,500 registered nurses, and 3,780 advanced practice registered nurses. One interesting thing about this is we were working on a project late last year that we were using data from the employment department. And I was looking at that data that's based off some of their unemployment wage information. And once I account for nurses who aren't actually performing what you would consider the occupation of nursing, so their administration or those kinds of things, these estimates and numbers from the employment department are really, really close. So we feel pretty confident that these estimates provide a reasonable outlook for the number of nursing professionals that are actually practicing in the state. So one other thing that we look at is we also look at growth, because that's really important for us to know if we're really concerned about shortages or where the nursing community is going in the future. And so what we've done here is we have provided you estimates for well, actually, we've given you the number of licensed and an estimate for how many are practicing since 2010 over year, and that way we can see the growth. And the first thing that jumps out is the APRNs down at the very bottom. We're growing the number of APRNs, both licensed and practicing, by about 6% a year, which is enormous growth. Keep in mind, when you look at these average annual growth numbers, that we're typically comparing it to state population growth, which right now is about 1.1, 1.2%. And so what you can see is, other than CNAs, which are actually declining just a little bit, but what you can really see is they've been bouncing around since 2010, from 18,331 to 18,101 in 2018. So you can see it's holding steady. It's really steady. It's bouncing around a little bit. LPNs are growing by a little over 3% a year. Both licensed and practicing are growing by a little over 3% a year. APRNs, I'm skipping RNs for a reason. The APRNs are growing by almost 7% licensed and just that 6% practicing, which means we're getting a lot more nurse practitioners and those kinds of folks into the state that we need, because we have other issues with physician shortages and other maldistributions of healthcare professionals where nurse practitioners may be able to step into some of those roles. For registered nurses, we're also growing. So the licensed nurses are growing at 3.3% per year on average, while practicing nurses are only growing at 2.2% per year. So the question that comes to my mind is, well, why? Because if you look at the other comparisons between the licensed practicing for CNAs, LPNs, and APRNs, you see the numbers correspond really closely. So we're growing 3.2% for LPNs licensed and 3.4% for practicing. That's really close. But for RNs, it's a whole percentage point different. And so this is a graphical representation. And what you can see is the green line is the number of licensing RNs, and the darker line, or the darker bar, is practicing. What you can definitely see is the diverging of those two numbers. Question that we always strike is, well, why is that? And this is why that is. So what this data tells us is this is how nurses, RNs, receive their license, either through endorsement or examination. What these basically mean are nurses who are trained in Oregon, who have done all their prep work, basically gone to school here. When they apply for when they try to get their nursing license, they have to take an exam, the NCLEX, and the Oregon State Board of Nursing flags those as they obtained their license through examination, because they were trained here, and that's all they really had to do is take the test and pass it and finish the paperwork with OSBN to become licensed. Endorsing nurses come to us from other states. They have all the credentials. They've probably been practicing in other state. They'll apply to get their license, and OSBN will verify all their documentation. And once that's verified, they will grant a license. What you'll see is that we are getting far more endorsing licenses than we are through examination. And the trend started about in 2010, where you can start seeing the uptick. But in 2013, it took off. To give you an example how fast this is growing, from 2013 to 2017, the number of licensed nurses through endorsement grew by 203%. That's 50% a year. Whereas when you compare it to the nurses obtaining their license via examination, in that same period between 2013 and 2017, they only grew by 23%, which is about 5% a year. And I know we say only 5%. 5% is still a lot of growth, but it's not the 50% per year. So one of the things that's augmenting us is that we also have a lot of nurses coming into the state. We do know that a lot of these do not practice in Oregon. We did a study last year looking at this phenomena directly, and we found that about 60% don't work in Oregon. They have a license because they work for a pharmacy management company or a health insurer or a large health system where they need to do triage and stuff on the phone, or telehealth. So they may not physically be in Oregon, but they may see some of the residents of Oregon because of business affiliates with insurance companies, pharmacies, whatever. Still, this does provide a lot of nurses into Oregon. This growth is unsustainable. Just statistically, when you see exponential growth, which is what this green curve represents, that can't go on forever. We're not quite sure when it's going to start slowing. We see, obviously, from this data, you see no evidence that it's slowing down at all. So it's interesting, but it does provide some information to us about how nurses are obtaining the license and how they're coming to be in the state. So that was another thing that was really interesting to us. The next part we're going to look at is we're actually going to look at age distributions. And I'm going to be switching back between two slides because it gives slightly different information. But what you can basically see is this is the age distribution of registered nurses from 2010 to 2018 by age group. And you can see the age groups on the left side of the column, and the proportion of nurses are represented in the percentages under each appropriate year. What I really want to spend some time on is the graph. The graph's a little busy, and in fact, we pulled 2010 off just because it makes it way too messy. But one of the things that you'll see from this graph, and you can see it from the data table in the previous slide, is that the nursing population for RNs in Oregon is getting younger. And we've seen this consistently from about 2010 to 2012, all the way to the present. It's getting markedly young. And you can see on this graph, so the brown line on the top of in the younger age groups is the 2018 data. And what you can see is when you look at the distribution or look at the frequency of younger age nurses, we've got more younger nurses in 2018 than we ever had before. In 2016, it was somewhat less. In 2014, it was somewhat less. And in 2012, it was less than that. So what you can see is when you look at the group, say basically around 50 and below, you can see that every year we're seeing incremental increases in the number of nurses within those age groups. Conversely, when you look at the distribution of nurses that are 50 and older, is in 2012, you can see the black line is there's 1,600 nurses that are 60. In 2016, it dropped. In 2014, it dropped a little bit. In 2016, it dropped a little bit more. And again, in 2018, it dropped even more, which suggests that what we're seeing is we really are seeing a distributional shift in our nursing workforce from an older population that we saw in 2012 and 2014 to a much younger population that we started seeing in 2016 and 2018. Just to give you an idea, so the median ages in 2012 was 51 years of age, which the data, it's reasonably obvious that seems to be about where the middle of it is. In 2014, that dropped from 51 to 49 years of age. In 16, it dropped to 47. And in 2018, it dropped to 46 years of age. So every 2 years, when we look at these data, we're seeing a reliable drop in the median age. What was really surprising to us is when we looked at the mode. And remember, the mode is the number that is the most frequent. So this basically says how many, if you look at any one age, where are the most nurses that we have of that age? And in 2012, we had more nurses that were age 60 than any other age group. In 2014, that age was 61, which means we had more nurses that were 61 years of age than anybody else. In 16, it was 60. So you can see that it's hovering right around 60 years of age. In 2018, we saw a big jump or a big change. The mode age in 2018 was 32 years of age. So what it did is it dropped from 60 to 32 in a 2-year period. And it's pretty evident if you look at the slide. So if you look at the brown line around 30 years of age, you will see it crest, and that's as high as it is. If you look at 2016 or 14 or 12, you'll see that crest is in much older age groups. So what this is basically telling us is that age distribution is shifting to the left. We're seeing younger and younger nurses, and now they're becoming more numerous. They're becoming a lot more numerous, so that we're actually have more younger nurses than we do older nurses. This is the first time in a long time that we've seen that. And so when you take all this together, one of the things that we keep being asked is, are we seeing a shortage? So what we did is we looked at those three things. We looked at just the standard growth. So growth rates for practicing nurses we're still growing them at least twice the rate of the population growth, which bodes well. We're also seeing high growth for endorsing nurses, which means we're bringing in a lot of nurses from other states. And RNs in 2018 are much younger than they were in 2012. And actually, they were younger than they were in 2012, 2014, and 2016. In 2010, 34%, basically 35% of RNs were less than 45 years of age, and the median age was 51. In 2018, it's now 45%, almost 46% of all RNs licensed in Oregon were younger than 45 years of age, and the median had dropped 5 years to 46. So that's a big jump to see that. We're also convinced, based on how many younger nurses we have, that we have enough younger nurses entering the workforce, or enough younger nurses are in the workforce, and they're entering in sufficient numbers to counterbalance mass retirements that we see in the older age group. And so these basically three sets of data together as converging lines of evidence really suggest to us that a statewide nursing shortage isn't really likely in the near future. Now, that doesn't mean something could happen with the economy or something else, some other external factor could influence this. But if things kind of hang as they are right now, we don't see any evidence that we're going to be going into a nursing shortage, just because our population of nurses is growing so fast. And it's growing kind of in the way we need them to be growing. We need a lot more younger nurses in the state to ensure that we have an adequate nursing workforce as the older nurses start to retire. So while we can talk about the lack of a nursing shortage, that doesn't necessarily mean that we are clear. We know that when we go talk to, especially healthcare providers in rural systems, they have an issue. And so one of the things we started to look at is, okay, if we don't really have a nursing shortage, but we know that there's either practice settings or geographic areas in the state that really seem to have a hard time recruiting and retaining enough nurses. So what we're doing now is we're starting to talk about a maldistribution. So the state has enough nurses. They're just not where we need them. They're just not in the right places. They're not either not working in the types of employment settings that we need, or they're not in the geographic areas that we need. And so what we're going to do is we're going to provide some evidence to suggest that indeed we do have maldistribution of nurses in Oregon. And this is the first set of data. One of the things we're looking right here at vacancy and turnover rates for registered nurses by practice settings. So we're looking at hospitals and health systems, long-term care facilities, home health hospice agencies, and public health agencies. And what you'll notice right off is that if you look at hospitals and health systems, they seem to be doing okay. They have a 5.3% vacancy rate and almost a 12% turnover rate, which is about what they've been for the past 4 or 5 years. It's pretty low. But then when you look at long-term care, especially long-term care, you see their vacancy rate is 28%, which means 28% of their positions that they have are vacant. Their turnover rate is 34%, which means that every year they're turning over about a third of their workforce. And you can see the same kinds of things in home health, hospice, and public health. Their turnover rates are very, very high, hovering right around 30%. And their vacancy rates are pretty high as well. Now, there's a lot of weird interactions between how, as nurses age, they move from setting to setting. We have data to suggest that once you hit about 45, nurses hit about 45 years of age, we see them leaving hospitals in pretty big droves. They seem to be moving out, and they move into home health and public health. Long-term care, they kind of keep, it's the age of nurses that work for long-term care facilities is pretty constant over the lifespan of a nursing career. So there's a lot of different dynamics, but what this really does tell us is that if you are in long-term care, you're going to have a harder time getting a nurse to come work for you than if you were working in a hospital or a health system. And so what that tells us is that we are having problems in some of our industry here in getting an adequate number of registered nurses employed. So that's one bit. And if you want to see more of this kind of data, you can go back and look at our demand study that we published at the end of last year. So you can see a little bit more information on that. But these data really do tell a story about how different practice settings have issues that are different across those settings. The next thing we looked at is geographic. We know that we have some geographic issues. When we go out to some of the rural parts of the state, they talk about how hard it is for them to get adequate number of nurses. So what we did here is we provided a fairly standard statistic for each county, which is an RN to population ratio. It's pretty simple to calculate, and that's all it really does is it says how many RNs are per person in the population of that county. So you're basically just doing some simple division, and what you see is there is a mass difference across counties on how many nurses are in the population. So if you look at Multnomah County, we have 68 people in the county for every one registered nurse. And then you can go to Gillum County, where they have 1,900 people in that county for every one nurse, and they only have one nurse that we can find evidence of working there. And so what you see is this is a way of saying, okay, how many nurses are there, and adjusting it by the county's population. And the counties that do well are the counties that you kind of expect. You expect Multnomah to do well because we're a big population center, and we have a lot of employers that employ nurses, so a lot of nurses come here. You can see the same in Clackamas, you can see the same in Washington, you can see it in Douglas, which has a population center of Roseburg, Deschutes with Bend. So those counties seem to be doing better off than some of the smaller counties. So what these data basically say is, yeah, we do have maldistribution. If the number of nurses in the state were distributed evenly, you would see all those ratios be somewhat similar, and they're not. They're really all over the place. You do see a lot of them in the mid 100s, 150, 125 to 170, suggesting that there's at some kind of stasis, but man, we really see some outliers. But I also want to point out very quickly that there are issues with using this statistic as a sole determinant of looking at geographic maldistribution. And that's because, especially for nurses, this can be influenced by a lot of things within the county that have nothing to do with healthcare provision. I mean, with the nurses per se, or with the community per se. In Sherman, Gillum, and Wheeler County, you can see that the ratios are very big, the number of nurses are very small. They also don't have a hospital in either one of those three counties. So you don't have an employer, which you don't have so you're not having a draw to bring people into that county to work. So these data are very definitive in that they show that there is a maldistribution of nurses geographically. And the data before, and this data suggests strongly that we have a maldistribution according to work setting. So while we didn't show any evidence in the data that we were facing a imminent shortage, we do find evidence, and it's fairly strong evidence, that we have maldistribution of nurses in the Oregon workforce. Vacancy and turnover rates differ markedly across practice settings. Hospitals seem to be doing okay. They have very low vacancy and turnover rates. Long-term care facilities, they're having a tougher time. Turnover rates are very high, over 34%, and their vacancy rate is sitting at the high 20s, which is really pretty high. We also have other evidence that we didn't present. HRSA, the Health Resources Services Administration under the United States Department of Health and Human Services, they put together about every 3 or 4 years, they do some projections on statewide need or demand for RNs and LPNs for each state across the country. And what they report is large variations across states in the supply of RNs and LPNs. For instance, in this latest report that HRSA put together, Oregon actually has a surplus. Not big, but they're projecting a small surplus of RNs and LPNs, which goes back to, if you go back and look at our earlier data when we're talking about shortages, that makes sense because we see rapid growth and a whole host of factors are accounting for the large number of RNs. But if you read that report, you will see that some big states, California and Texas, both are they're predicting or projecting a deficit. So you see some maldistribution across the country in terms of states like Oregon, which actually have a small surplus of nurses, and there are states that have a bigger surplus than Oregon. And then you have some states, in this case is California and Texas, and I point that out because they have huge workforces, and having nursing shortages in those states could be detrimental to the health of those states. But what also shows is you see some maldistribution across it. Within Oregon, the disparity in the RN to population ratio show that some counties are doing better than others. And we also have anecdotal evidence from rural healthcare workers. The Oregon's Office of Rural Health every couple years goes out and talks to employers in rural parts of the state to find out what are their issues, and try to dig a little bit deeper, just saying, oh, we don't have enough nurses, but actually try to go in and find out what's going on with those nurses. And we find that some do have problems. We talked to some folks in Gold Beach, in John Day, in Roseburg, and a couple other places, and they're basically saying they do have shortages. The reasons they're having issues differ. In John Day, one of the big issues they had was housing, employment opportunities for partners of the nurse coming in. In Gold Beach, it was different. It was a lot of housing, but they had other issues going on. So there's lots of different evidence to suggest that maldistribution is going on. And lastly, we didn't talk about it. I didn't present it here, but when you look at the employment department data, especially if you look at their job opening survey by regions, you'll see that they are reporting massive differences in the number of job openings by OED region, which is a conglomeration of adjacent counties, and they show market differences in the supply or the demand and need for nurses across different OED regions. So this basically suggests there's 2 or 3 lines of evidence that are fairly convincing that we have a maldistribution. So we basically have shown that a shortages is unlikely, a near-term shortage is very unlikely. We've also provided ample evidence of maldistribution across practice settings and geographic area. Now, one of the reasons we're really focusing on this is because if we start really talking about shortages and stuff, when we're talking about statewide, it's very difficult to get your head around, your arms around what's causing it. And in reality, given the diversity of geographic diversity within Oregon, it's likely that there's several different things that are causing that localized shortage or maldistribution. When you're looking at maldistribution across practice settings, it's sometimes fairly clear what you can do, what kind of interventions can you do to minimize the impact of that maldistribution. So if you're looking at long-term care facilities versus hospitals and hospitals and health systems, you know that they have a really high turnover rate. So there's things we can do, such as transition to practice programs, mentoring. There's a host of interventions we could do to augment retention or to increase retention, which would minimize or at least reduce the impact of maldistribution across practice settings. There's also things you can do for recruitment. A lot of these strategies are fairly well known in the literature, and a lot of organizations within Oregon are doing things. We're looking at transition to practice programs. We're looking at nurse residency programs or long-term care and home health agencies. We're doing a lot of things, and the maldistribution helps point the way of where we need to do and what do we need to focus on. Is it recruitment? Is it retention? Those kinds of things. When we look at geographic maldistribution, even though we have ample evidence it's there, we know that it's varied. We know that the causes or the factors that leading to geographic maldistribution are varied, and they appear to us to be very localized. So things that impact one community may or may not be the same factor in another community. So while geographic maldistribution we have evidence for, in and of itself, it doesn't tell us what to do about it because we don't know exactly why it happened. So what geographic maldistribution does is, one, we can identify it, and there's lots of ways to identify it. So these data through employment department data, you can identify them, but you're not really quite sure what to do with it until you go in and start talking to the local communities, which I believe that in order to start dealing with some of the geographic maldistribution in the state, we're going to have to basically bring together groups, education, employment. We're also going to start talking to city planners and city leadership and county leadership so they can tell us and understand what socioeconomic factors in that county or in that city are causing, that could be leading to the fact that people aren't going to those communities. It could be housing, it could be a whole host of things that, you know, until you really get in and start talking to the leaders within that community, you really don't know. So that is really the end of the presentation. We're really trying to use this information, these data, to change the way we're thinking about it. When I first started working here, that's all I really heard was everybody was talking about shortages. You go to conventions, you go to meetings, and folks would talk about shortage or no shortage. And that seemed to be the criteria folks were used to determine whether the state of nursing was going on the right track or the wrong track within their state. And while we don't have any evidence for shortage, we have definite indications that we have maldistribution going on. And if we want to ensure that all communities with Oregon have access to adequate, high quality health care, these are some of the issues we need to start addressing. And so, but by doing more research, by actually getting into the local communities and talking to local leaders, along with state leaders to understand, you know, the educational pipeline and stuff, but we really need to understand the factors within a community that can lead to a maldistribution or folks not wanting to be in those areas.
All right, thank you, Rick. I'm checking to see if there's any questions. Okay, Rick, can you share a little bit more about the Endorsing Nurses study and what
Sure.
what we were doing there, what we learned from that off of the top of your head?
Sure. So we were approached by OSBN, the Oregon State Board of Nursing, because they were noticing when they do their outcome studies, they were noticing a very large number of nurses being forced that weren't. And one of the things we don't know, we knew that was kind of happening, but we didn't know why. So we grabbed some data from OSBN and we actually surveyed these nurses. Everybody who endorsed in since 2013, we actually surveyed them. Got a fairly high response rate and found a couple things that were relatively surprising. First off, a majority of people who are endorsing into Oregon they don't live here, they don't practice directly here. So they don't have a work address in Oregon, nor do they live here, which isn't too surprising when you start looking at the consolidation within healthcare. A lot of it's multinational or multi-state companies, organizations. They have headquarters in different places. And so what we found is a lot of the endorsing nurses, they just work elsewhere, but happen to be in a workplace where they serve Oregon residents and they had to have a license for it. As you can imagine, our neighbors were our biggest source of endorsing nurses. Washington, Idaho, California were the big ones. Texas, Florida, Arizona were also big contributors to the endorsing nurses. Most of those nurses work for pharmacy benefit managers, health insurance companies, or health plans where they were doing triage and stuff, and some telemedicine. While they touch clients in Oregon and need the license, they're not necessarily physically here and probably don't plan on being here. One thing that kind of surprised us was that a lot of nurses said that they were required to have an Oregon license as a condition of their employment. So that kind of added to the idea that they're not going to be here, but they're required by their job to do it because they have, in the course of their workday, they may be interacting with residents of Oregon.
And I think based on that survey that we did and some of the other things that we have heard from people, it's pretty clear there might be some more study to do on the nurses that are using telemedicine or some other innovative ways to provide, that nurses are providing care to people that may not necessarily be like, you know, in person and actually practicing in the state. So that's something that might come up as far as our research in the future.
We know that we have a lot of endorsing nurses. We know a lot of the reasons for it, but we want to take another look to ensure that we're on the right track. We just need to replicate the study to take a look and ask a somewhat different set of questions to understand a little bit about the state of endorsing nurses. When you talk about telemedicine, telehealth, those kinds of growing industries are really hard for us to track. One, we had a question of whether it was an employment setting. Well, it's not an employment setting. There is a couple questions about specializations that incorporate telemedicine, telehealth, but they're very poorly, they're not complete. We don't believe the data is accurate or complete. So we don't really have a good sense of how many nurses are actually providing services via telehealth or telemedicine. We really just don't know. And so we know that is a growing part of healthcare. It's a very growing part of the healthcare industry. We would like to take a deeper look into it at some point.
We do have another question that was asked. It was, what are your potential plans for further investigation of the issues on why there are higher turnover rates in long-term care facilities?
It definitely is something we would want to look at. I don't have a research plan for that. It is not on this year's research agenda, so I really hadn't thought about it. It is something we are going to definitely want to take a look at. So when we look at home health and public health that also have high turnover rates, what you see is those types of careers seem to attract nurses at the end of their nursing career. So once you hit 45, 50, 55 years of age, you start seeing employment in those settings increase. And then the turnover is likely due to their retirements, because it looks like they'll work somewhere towards the end of their career, they'll go work for a home health hospice agency or a public health agency, and then they'll retire from there. That kind of pattern doesn't happen in long-term care. The age distribution of nurses working in long-term care is fairly flat, which means they're coming in and leaving at all stages of their career. And so we just don't understand exactly why they're leaving or why they're having such a hard time attracting nurses. So it is something we would want to look at, and it may be something we put on next year's research agenda so we can actually take a deep dive and try to understand some of the factors that cause those high vacancy and turnover rates.
And another question that has come up is, are there states that have better distribution of nurses, and do we know what their intentions were or what their best practices were to encourage a better distribution of nurses across practice settings or geographic areas?
I know a couple states that have similar kinds of problems. I know, for instance, Texas has maldistribution, geographic maldistribution, and it appears to be very similar to the maldistribution we see in Oregon. Like Oregon, Texas has very broad stretches of parts of the state that are very, very rural, and we had that too, and that's where it seems like we had the hardest time getting nurses into. Some of the other smaller New England states I haven't seen. It would be interesting to see if some states are more equitably distributed across the state and just kind of see what they're doing. And it also may be that states that are predominantly metropolitan rather than rural may have a less of an issue. My guess is that what you're going to find out is the rurality of the state that has a large impact. Now, it may not be the cause. It probably could be other things that cause it, but it'll probably be related to what proportion of the state is rural versus metropolitan.
Another thing I want to point out is that not all states collect this level of data.
Sure.
There are some states that collect this level of data that we're collecting and look at it this way. There are other states that they don't look at the number of nurses that are coming in from out of state at all. But that's not really on their radar, and they don't examine that as part of their supply. We have always really included it in the state of Oregon, just because that's if you looked at the graphs from earlier, it's a really important part of the supply of nurses that are in the state, and we really started taking a look at it once it started growing by 50% a year. That's impacting us a lot. In other states, they're just starting to take a look at that because that's not a metric that they have traditionally tracked. So it's really hard to figure out what the best practices are right now because this is a pretty new phenomena about where nurses are being educated, where they're migrating to, and the telehealth. This is a pretty new thing. So we're all, many other states, we're all kind of communicating with each other to try to figure out what are those best practices for redistribution and how do we best make sure that we're taking care of the communities in our states.
And another question that has come in is, do you, and I'm assuming that means Oregon Center for Nursing, ever do exit interviews with individuals who are leaving employment?
So the Oregon Center for Nursing we try to work with data that is being collected, like that kind of data would be collected at an employer level. We've talked to employers before, and kind of the challenge with exit interviews is that a lot of times a nurse will leave their job, but they won't necessarily leave nursing. So exit interviews don't really give us a lot of detail about where nurses are shifting among the different settings and the different professions. We've talked to them a lot about this, and in some cases, exit interviews aren't even conducted. So it's not really a metric that we have used. I think if we ever do any kind of an exit survey, it would have to be a sample type of the survey that the Oregon Center for Nursing would have to do to try to figure out like where nurses are moving within the career. But yeah, we don't really do that.
Another question that has just come in. Does the data exist that would support the idea that schools and waitlists are sending students out of state, and to get back to their home state, it has to be done by endorsement?
We don't have any evidence. Well, one, we don't get that level of detail, so we wouldn't know exactly what happens to an individual applicant. I've never heard that.
I haven't heard that either. I do remember a situation where there was a student from California that was being educated in Oregon. And I was working with her because she was trying to figure out where she should take her examination because her intention was to go back to California. Mm-hmm. And it was strongly advised that she take the NCLEX and the examination in the state that she intended to be practicing in. Oh. So it wasn't a matter of, you know, the student who was from California who intended to practice in California but came to Oregon for education was highly encouraged to take the NCLEX in her state and not endorse in the other way. So that's the one piece of evidence from one student in one example. I don't think we have data that kind of gets down to that level.
We do know that in our, especially in our BSN programs and even in our ADN programs, we have acceptance rates that are in the 20 and 30, 40% range, which suggests a lot of applicants aren't able to get into school, but we don't really know if they're being advised to go to another state. The only information I've heard about that is I know in Idaho, my counterpart in Idaho has said that they know that they're graduating and educating a lot of nurses that have no intention of staying in Idaho, that they're definitely going to be leaving. But in Oregon, I've never heard that.
So if I can jump in really quickly, back in 2015, we did a survey of newly licensed nurses, and all newly licensed nurses who had applied by examination in the state of Oregon over a year period of time were invited to participate in the research survey. And there we found about 18% of the students were educated in a school outside of Oregon, and then were coming back to Oregon to apply for their license for their first time.
Any other questions?
All right, well, hearing none, I think we'll go ahead and wrap this up. Thank you, Rick, for the presentation of all of the data. Thank you for Kelly for putting everything together for us. And thank you to everyone who attended. We really appreciate it. All of this information can be found on our website at www.oregoncenterfornursing.org. And also Rick's email address is right up here on the screen. If you have additional questions, you are welcome to email him or anyone at the Oregon Center for Nursing. We're really excited to be able to share some of these findings with you and continue the research so we make sure that Oregon has the healthiest communities and with the best nurses all throughout the state. So thank you, and have a good rest of your Thursday.